Brian Kroback just ran in a half marathon to promote awareness about breast cancer while having stage 4 male breast cancer. He doesn't look at himself as someone with a terminal illness, but rather a person in a position to inspire others.
You know, I've spent a lot of time on my knees praying. I've never asked the Lord why me. I always thought, why not me?
He was diagnosed in 2011, went into remission, then diagnosed again. Brian says it's important for men to get checked by doctors. Dr. Emil Fernando, who is a breast surgical oncologist at Allegheny Health Network, says if you see a lump, take it seriously.
A lot of the times it's either dismissed by either your medical team or the patient themselves as, oh, what is this? Is probably nothing, or a pulled muscle. And usually it'll persist, it won't go away, and then over time it'll start to get larger.
Fernando says about 317,000 women will be diagnosed with breast cancer this year. That's compared to 2,100 men. It's rare for men, but more men die of the disease compared to women.
However, men are usually diagnosed later, so about 500 men a year, almost approaching a quarter of diagnosed patients, are dying from the disease.
So what do you need to look for on your body?
There's a lump or a ball, feels like a marble. That is, of course, unusual. That's not normal. Or certainly if your nipple starts to look any different, or if there's any fluid, any discharge from the nipple.
If the lump is cancer, you have the option of surgery, radiation, and medicine to block estrogen or chemotherapy. Men can also have a lumpectomy and mammograms. Dr. Amy Kelly is a breast radiologist for UPMC Magee Women's Hospital and has treated men for breast cancer.
And it is effective even in men. If there's anything suspicious on the mammogram, the next step would be to do an ultrasound and thereafter potentially a biopsy.
Both doctors say Brian's story of him running in the half marathon is something patients need to see. Knowing his condition, what are your thoughts about him running in this half marathon?
I think that's really amazing. It's really inspiring that, to find that inner strength and motivation to really say, I'm going to still fight this and beat this.
I thought that was amazing, and I was so proud of him.
Doctors say if you're unsure, don't hesitate to get checked. And if you still feel uncomfortable, ask another doctor. Covering Allegheny County in Oakland, Chandy Chapman, Pittsburgh's Action News 4.